In today's mini lecture, we'll be discussing contextualizing and prioritizing treatment goals. When we refer to contextualizing treatment goals, we're referring to defining treatment goals so that each goal can be understood in the context of corresponding behaviors under certain conditions and at particular levels. So, what specific behaviors will your client exhibit, in what situations, and to what degree? So, here you're clearly outlining the behaviors that your client will exhibit when they reach their goal, when these behaviors will be exhibited, with whom, and to what degree. So, it's very important that you define your goals in behavioral terms. What particular behaviors will your client exhibit? And the goals need to be operationally defined so that they are easier to evaluate. So when we talk about operationally defining goals, we talk about discussing goals in ways that can be measured. So if your client were to come into you and say, I want to be more confident, that's not really a goal that you can measure. It's not operationally defined. You'd want to ask your client to describe what they will be doing as a confident person. So they may say something like, when I go to a party, I will initiate conversations with 5 new people. So that's a goal that's operationally defined. You can clearly measure whether or not when they go to a party, they initiate conversations with at least 5 new people. So other ways you can kind of tease apart what behaviors your client will be exhibiting is to say, what would that look like? So if you're confident, what would that look like? When you reach this goal, what do you see yourself doing? So you want to clearly identify the behaviors that they'll be showing. You also want to describe the conditions of the treatment goals. So where, when, and with whom will the behaviors associated with the goal occur? So your client may not have any issues with social phobias when it comes to platonic relationships or coworker relationships. They may struggle with social phobia or social anxiety when it comes to dating situations. So then you want to center your goals around having them show more pro-social behaviors in dating situations as opposed to with coworkers or with friends. So you clearly want to define where the behaviors will occur, when, and with whom. So you want to ask your client things like, where would you like to do this? In what situations do you want to be able to do this? When do you want to do this? So you want to understand the conditions under which the behaviors will be displayed. You also want to outline the levels of change. So you'll determine the level or amount of the behavior change that your client will try to achieve. So this could be the frequency of the behavior. So how often or how many times do you want to do this behavior? So how many times would you like to approach a new person when you go to a party? Or how many times a week would you like to speak with your family? So these will be measures of frequency. Duration refers to how long the behavior lasts or the amount of time you perform the behavior. So now you talk to your mom, but you tend to cut the conversation short. You'd like to increase the duration of your conversations with your mother. So a goal could be when you speak to your mother, you'll talk to her for at least 30 minutes. Or let's say you're trying to increase the amount of time you spend studying every week. So currently you only spend 2 hours a week studying. Your goal can be to increase that duration to 4 hours a week of studying. You can also describe the behavior in terms of intensity. So what is the strength of the behavior? What would you like your level of confidence to be on a scale of 1 to 10? So currently you rate your confidence as a 2. What is your ideal level of confidence or the level of confidence that you hope to achieve? Let's say you're working with somebody on public speaking. They want to increase the intensity of their voice. They want to increase their projection or increase their volume. So these are all different levels of change: frequency, duration, and intensity. So how do you prioritize and sequence your treatment goals? So your client should have both ultimate outcome goals and intermediate outcome goals. So ultimate outcome goals refer to the destination of therapy. So where do they see themselves at the conclusion of therapy? But in addition to those long-term goals, you want to have intermediate goals. So these are goals that are achieved along the way to the ultimate outcome goal. And you want to arrange your intermediate goals in sequential stair steps to reaching the ultimate goal. So you start with your long-term goal, where you want the client to be or where the client wants themselves to be at the conclusion of therapy, and then you construct those intermediate goals and stair steps to show them the sequence of arranging those intermediate goals to ultimately reach their long-term goal. And this may involve shaping, which is the reinforcement of successive approximations of a goal behavior. And so if you remember from discussing this in learning, sometimes the client is not showing the behavior that they ultimately want to show. So rather than having the goal be to show that behavior, you may have to reinforce successive approximations of that goal. So you're reinforcing the steps along the way to that goal. So let's say that your client's ultimate goal is to approach 5 new people at a party to increase their pro-social behavior. If they're not at that stage yet, if they're not able to perform that behavior, you may start with, can you reciprocate conversations with 5 people? So when people start conversations with you, can you maintain those conversations? Or can you make eye contact with 5 new people? So you may have to start with the behavior that is not quite the ultimate behavior that you want them to show, but you're going to reinforce them along the way. Maybe first they make eye contact, then they reciprocate conversations that are started with them, and then they're able to initiate conversations with people at the party. So as you plan how to reach goals along with the client, you want to plan for obstacles and how obstacles will be addressed. So you want to anticipate things that are likely to create problems for them reaching their goals. So you want to ask them things like, who or what might prevent you from making progress? What thoughts or feelings might get in the way of change? So it's important that you focus not on, what outside the client could create obstacles, but what within the client could create obstacles toward achieving their goal. You'll also want to identify resources that could facilitate goal achievement. So discuss things with your client like, tell me more about the support system that will help you. What skills do you have that will help you achieve your goals? So again, identify things outside the client, people or things that will help them achieve their goal, but then also things within the client, like their particular skills or abilities or knowledge that can help them progress toward their treatment goal.